Initial recommendation. I would like to offer some guidance on how to care for patients who have suffered a head injury and are being discharged to continue recovery at home. It is very important to closely monitor the patient, especially during the first few days. Critical observation period. The first 1 to 3 days, 24 to 72 hours after the injury, are extremely important. Even if the brain scan, CT, shows no abnormalities, some symptoms may not appear immediately. Close monitoring is essential. Warning signs that require immediate medical attention. If any of the following symptoms appear, bring the patient to the hospital immediately. Excessive drowsiness, unresponsiveness, or delayed response when called. If the patient is asleep, wake them every 2 to 4 hours to check their response. If they cannot be awakened or are slow to respond, seek medical attention immediately. Slurred speech or unusual speech, weakness in arms or legs, imbalance or unsteady walking, nausea with repeated vomiting or projectile vomiting, seizures or body twitching, sudden behavior changes such as irritability, confusion, or staggering, crossed eyes or double vision. If any of these symptoms occur, do not wait. Bring the patient to the hospital immediately. Medication instructions. If the patient has a headache, paracetamol, acetaminophen is allowed. Avoid aspirin and anti-inflammatory medications such as ibuprofen, as they may increase the risk of bleeding in the brain. For elderly patients, some symptoms may appear late in older adults, even 4 to 5 days after the injury. Therefore, if any unusual symptoms develop later, do not hesitate to return to the hospital. Patient care instructions during the observation period. 1. Ensure a caregiver is present at all times. The caregiver should understand the warning signs and monitor the patient's responsiveness. Pay close attention to whether the patient becomes less alert. Continuous observation is necessary for at least the first 24 hours. 2. Avoid heavy physical activities or exercise. 3. Avoid driving or operating a motorcycle for at least 24 hours. 4. Do not take medications that cause drowsiness, such as cold medicine or sleeping pills. Consult a doctor or pharmacist if unsure. 5. Avoid all alcoholic beverages, such as beer or spirits. Alcohol can interfere with brain function and recovery. 6. Eat soft, easily digestible foods, such as rice porridge or soup. Avoid spicy, oily, or hard-to-digest foods to protect the digestive system. 7. If swelling occurs at the impact site, apply cold compresses, ice pack, for the first 48 hours, 3 to 4 times a day. After 48 hours, switch to warm compresses to improve circulation and reduce bruising. 8. If the swelling worsens despite cold compress or any abnormal symptoms appear, bring the patient to the hospital immediately. Do not wait or leave them resting at home unattended. When in doubt, if you notice any abnormal symptoms or are uncertain, don't hesitate to call the hospital anytime. We wish the patient a safe and speedy recovery. Stay well and healthy.